Welcome to Module 2, Wheelchair Service Provision Best Practices Consideration for Telehealth. This is part 1 of Module 2. Module 2 will focus on the RESNA Wheelchair Service Provision Guide and the considerations needed to consider telehealth for this process. The different steps in the RESNA Wheelchair Service Provision Guide are referral, assessment, equipment recommendation and selection, funding and procurement, production and preparation, fitting, training and delivery, follow-up, maintenance and repair, and outcome measurement. Part 1 will focus on referral, assessment, and equipment recommendation and selection. In the Service Provision Guide, referral is identification of need for the consumer and caregiver goals, as well as referral to qualified professionals. In regard to telehealth versus in-person assessment, asking if a consumer has preference for in-person or telehealth would be the first step of a screening to identify if telehealth is appropriate. Additional considerations would be transportation needs, medical status, and other considerations for telehealth that will be described and referenced in Module 4. Referral to qualified professionals for CRT provision, in addition to consideration to referral to professionals skilled with telehealth services, and is an additional consideration for telehealth. Assessment includes multiple aspects for both the clinical professionals as well as the assistive technology professionals. Current technology and environment, equipment used for mobility, environments of use, family and social support and caregivers, attitudes toward disability and technology, activity and participation, and body functions and structures are all aspects that are reviewed in the assessment. For assessment of current technology, the environment, caregiver support, telehealth services provides ability to visualize the consumer in their own environment. This can actually provide more insight in some cases than in-person assessment, as remote and in-person team members can see areas where devices work well or have difficulties and see the consumer perform activities that would occur in their regular environment. The assessment of body functions and structures can change significantly depending on the consumer's abilities and their needs compared to the in-person assessment. If the clinician and physician are remote, hands-on assessment will not be possible during telehealth. Different methods may be utilized. For example, strength assessment may be deferred for assessment of active range of motion or functional activities, and passive motion may require a caregiver to assist if the client is unable to do so independently. Safety is also a consideration, as clinicians may typically perform assessments with hands-on to prevent loss of balance or injury. Without a clinician present in person, some aspects of mobility and other assessments may need to be modified or deferred if safety is a concern. If during the telehealth assessment of body functions and structures, it is determined that the assessment needed is unable to be performed with telehealth strategies, or there are areas of assessment that are concerning and will require in-person assessment, reevaluation in person may be warranted and scheduled at another time. Equipment recommendation and selection includes trial and simulation with equipment, client funding, education and exploration, and documentation. Depending on which team members are in person, this may need to consider how transfer is performed to the equipment for trial. If an in-person team members are not appropriate to assist with transfers or are not comfortable doing so, they may defer to a caregiver, reschedule for in-person or in-clinic trial, or when a clinician or other in-home assistance is available. Prior to the appointment, it would need to be determined what type of equipment should be taken for trial. If determined that other types of devices are necessary to try that are not available during the appointment, it would be appropriate to schedule additional appointments for these trials. In regard to funding and documentation, there would typically be no significant difference in process from standard in-person best practice. Documentation may vary somewhat in regard to assessments and the strategies of telehealth methods, but general principles for documentation will remain the same. Funding options and process for funding should not be affected by use of telehealth, so following best practices described for typical in-person methods is recommended. The next presentation of Module 2 will address the remaining areas of best practice for the process of wheelchair service provision.